Am I missing? No. Okay. We will proceed.
25.
Number 25. What do you call a physical assessment in taking blood pressure? Meaning to say,
Manual
so what is your answer there?
Manual BP. Measurement.
Manual BP, yeah. But the thing is that yung physical, the physical assessment that I'm asking when you take the blood pressure is that when you do the blood pressure, the arm should be the heart, the level of the heart of the patient, and it's slightly flexed on the elbow. The BP cuff with the bladder in the midline of the brachial artery. Meaning to say, it should be, the blood pressure is on the level of the heart, and the BP cuff should be on the bladder, the midline of the brachial artery. Even though you and on a proper way, you could not get of the patient. I'm asking here, naintindihan nyo? I'm asking here the physical assessment. What physical assessment. Susmita, did you understand me?
Yes, ma'am. I got you.
You got
yung
it, yeah.
answer.
The arm should be the heart and supported level cuff should be, because even though if you have a manual blood pressure, you could not get the right. And at the same time, never take the blood pressure of the patient is just yung tired ba yung naghihingalo pa siya, let the patient rest first before you take the blood pressure of the patient. Okay, maybe 5 to 10 minutes will be okay. Do not take the patient if it's he's
Tired.
After exercise, or if he just drink coffee also.
Just drink water.
Yeah, drink water. Because
water.
you know, when you take the blood pressure of the patient when he is tired, you will be able to get the high blood pressure of that patient. And even when you get the respiratory rate and the pulse rate, it's all high because he is tired. Okay? Now we will go in matching type.
Nako, ito lang ayaw po.
Matching type. Why? Why you don't like?
Mahirap, ma'am.
Mahirap?
Okay lang po, mag-challenge, ma'am.
You know, right now there is they told that there is assessment for final assessment for each learner. That's why I want to teach you. I want you to pass everything before you go for the what do you call this one? For the you go for the hospital experience like that. Yeah, I just want you to know everything. Yeah, simple thing like I think they asked one student what is the meaning of ADL. So recently that we have we also study about the hygiene and grooming, and we discuss it what is ADL. So what is ADL?
Activities of daily living.
Activity daily living.
Daily living, yeah.
Okay. Please remember, always remember that one. Maybe they will ask you some questions. Okay. Also some abbreviation, also medical term, which is common. Now we will go to matching type. Now, what do you? It keeps the skin free. Free from bacteria, free from
bed bath.
Okay, bed bath. bed bath. And normal patient, the normal person, we have to take a bath so that we are skin free from infection or even from illness. It's a cooling treatment used in febrile patient. What do you call the febrile patient? Having fever. So what do you call for that one?
Tipid sponge bath.
Or tepid sponge bath. Yeah, we usually do tepid sponge bath for the patient who have high fever because it lessen when your patient become high, the body temperature of the patient, and that we usually do in hospital. And number 3, tissue breakdown resulting from compression of soft tissue.
Pressure ulcer.
Pressure ulcer.
Pressure ulcer. It is a neuropathy on the sole of the feet.
Diabetic one din.
And it is the venous wound. Venous wound. Yeah. The leg in area exposed to repetitive trauma and pressure.
Arterial one.
Arterial wound.
Okay. And then number 7, it is an open wound on the foot caused by complications from diabetes.
Diabetic.
Diabetic foot.
Okay, good. You know, in this number 7, there are so many forgot it. There is already there diabetic complication. So it's also, the answer is already there, but it's still wrong answer. So it's a complication, complication of diabetes. So diabetes is there. It's an open wound. So it's already there, diabetic wound. Okay? And then skin and mucous membrane breakthrough.
Wound.
Wound.
Okay, wound. It is caused by poor arterial and venous blood flow.
Vascular.
Okay. It consists of dermis, subcutaneous, and epidermis.
Skin.
Skin.
Okay. Okay. Absorb drainage, promote comfort, protect wounds.
Dressing.
Dressing. Yeah. You know, I consider this one, it's a dressing. Some answer goes. Some answer, for it should be specific. So the medical term is dressing, but some answer goes. I consider already goes because the dressing that is used is goes. But next time you will answer this one, you have to write dressing. Okay. Saan na ba tayo? Applied to abdomen, chest, or perineal care. Perineal area.
Binders.
Okay. And then blood vessels constrict. This is decreased circulation, swelling, and bleeding.
Cold application and compress.
Cold
Okay.
application.
Cold application or cold compress. And then promote healing, comfort, reduce swelling.
Hot compress.
Hot compress. When you have a patient for 99 Fahrenheit to 110 Fahrenheit, what do we call for this one? Febrile. Usually, if the patient become 100 plus already, you will think for the conversion for Celsius, it's already febrile. If 100 plus, it's already febrile. Okay. If it's less than 100, it's still normal. Okay, for the conversion for Celsius to Fahrenheit. Okay, and then how about this one? 80 to 100 per minute.
Sphygmomanotory.
What is this?
Pulse rate?
Yeah, it is a
Rate.
normal pulse rate of the patient. Yes. How about if there is you took the patient 80 over 100 millimeter per mercury? What is that?
Blood pressure.
Yeah, you are taking the blood pressure of the patient. How about if you will take the patient for 30 to 80? This is an
Respiratory.
okay. This is respiratory. Actually, for this one, 30 for 80 minutes for a child. Now, it is an instrument to measure blood pressure. Sphygmomanometer. Okay.
Manometer.
Used to determine circulation of the foot.
Pedal.
Pedal, yeah.
Pedal.
Usually, this one in pedal, they will see to it if it's already your foot have a good circulation. You could see also this one if there is an edema or swelling for the patient. They call pedal edema. Also in this pedal area, you could see also if there is any like for the varicose vein of the patient. Okay.
Ma'am, yung number 14, ano yun? Number 14.
Number 14.
Binders.
Promote healing, comfort, reduce swelling. Hot compress.
Yung 14. 14
Sorry,
yung
ma'am, yung number 3.
Hot compress.
Number 3, it's letter A, pressure ulcer.
Oh, okay po.
Now, how do you maintain skin integrity with a patient with a pressure ulcer? If you don't have, at least give me 5. Okay, Esther, give me 1.
Pressure. I remember.
Esther daw.
Kasi ako.
Esther.
Ako dun.
Keep hydrated.
Okay. Diggs.
Wait, ma'am. yung ano yun yung ano ma'am yung
How do you maintain skin integrity of the patient with the pressure ulcer?
Oh,
wait.
explain po ba yon?
Hindi.
Even though you will just enumerate, at least you could.
Ma'am, una in-explain ko mahaba. Kaso nilagay ko na lang yung yung
yeah, it's okay. It's okay.
Ala, explanation po yung nilagay ko.
Okay lang.
Pala yun.
Okay lang.
Saan na yung ko dito?
Din yung akin doon.
Sus, give me 1.
Explain din namin, ma'am, kasi explain. Ganun.
Give me 1.
Explanation lang po yung
Like
Patient
why you have to let the patient dry like that? Because in nursing or in caregiver or in nursing aid, you need when you answer a question, always there is a reason why. So you have to turn the patient like that. Why you need to turn the patient like that? So you have to give good foods, nutrition. Yeah, like that.
Shower or bath using
so
warm
it is
water.
written there. I have written there in your in the slides, and you will study for that one. Okay. So any question for
hydration?
Any question for our vital sign, wound care, dressing, bath procedure?
Dahil ko bang mali sa
Sana po, ma'am. Sa next po, sa BLS. I don't know if we will pass there.
You know, you will know who passed already the BLS. Yeah.
Sila na po, ma'am. Sila na po. Ako,
Gina, do you have already BLS?
Yes, ma'am.
Okay. Sus, you have already BLS?
Yes, ma'am.
Okay. I will ask.
Solo lang po kami, ma'am.
Lina, you have already BLS?
Yes po.
Diggs, wala ka pa?
Meron naman.
Meron naman. Okay.
Mga veterano na po yan, ma'am. Mga
Esther.
certified.
Hindi naman.
Esther.
Hirap din.
Wala pa, no?
Ma'am.
Pero ano, makakapasa ka. You can pass. Irene?
Yes,
Perfect.
ma'am.
Yeah, Irene, meron ka na?
Wala pa po.
Wala pa. Si Big,
Ay.
si...
Wala pa po.
Sino pa ba?
50-50 po yan.
Hindi, okay lang. You know, it's also
Panalig
good.
lang.
for-
Challenge po.
Okay, it's very good. Now, I want you to... but after this one, I will give you some questionnaire to study also because you need to pass the BLS. Number 1, shortness of breath, anxiety, chest pain radiating to arm, and how do you describe this one? What is this?
Heart attack. I think.
Oh my God. There is
Hindi ko
to answer
alam.
heart attach.
Ako ba yun?
Heart attach.
Ala! Parang ako ata yun.
Okay, I understand it. It's but next time you you check for the spelling. Somebody when I check it, I'm having heart attach also.
Heart attach.
Attach
Yeah,
ma'am
heart
nakalagay?
attach daw.
Ala,
Oo, heart attach.
hindi ako
Wrong
yun.
spelling yun.
Chinek ko siya.
You check your answer. It's heart attach. It's a universal sign for choking. You know the patient having choking. What you will see for the patient who have this choking.
Difficulty breathing.
What else? The first one you will
Can-
see for the patient.
Stuck
Cannot
to-
speak.
No.
Whole
The
hand with
patient.
whole leg with hand.
Usually, when the patient have this choking, you will see the patient they put their
Whole
hand
hand. Yeah.
Can't breathe.
their neck that they cannot breathe already. They cannot speak. But before that one, first thing that you will see, they will hold their hand and put on their neck. And then succeeding is that they cannot breathe and then they cannot talk. Number 3,
What's the answer, ma'am?
freezing of tissue
Done.
fluids.
Ma'am, ano pong
Frostbite.
right answer sa 2, sa difficulty po? Yung sign, yung universal sign of choking.
Hand placed around the throat. Or
Ano
neck.
po?
Ano
Hold
po?
the neck with hand.
Ano po sa
Hands.
number 2, ma'am?
Hands placed around the throat or neck. It's I copied this one in the BLS BLS book.
Hands placed po. Ano, ma'am?
Hands
yung
placed
kamay,
around the
nilagay
throat.
Around.
Yeah.
around the throat or neck. Yung kamay nilagay dito. Dito sa hindi sila makaano. Hinga. Number 3, freezing of tissue fluids.
Airways.
Frostbite.
Frostbite.
Right.
Yeah.
Oh.
Overstretching of muscle can result in
Muscle strain.
Muscle strain.
yes, muscle strain. But some answer sprain. Sprain and strain is different. Okay?
Yes, ma'am.
When you say that it's overstretching of muscle, it is called strain. But when the muscles or the ligaments or joints have been twisted, you can call that sprain. Sprain. Pag na-twist yung yung ankle mo, yung mga ligaments mo, ibig sabihin sprain. Pero pag
Okay.
overstretching, it is strain. Now, sterile covering place over the wound.
Cut and craft.
Sterile covering place over the wound.
Dressing ma'am?
Dressing po.
Dressing, always say if it's sterile covering or is dressing or Something for covering for the wound. It always tell it's dressing. Gauze.
And what about gauze?
Gauze, but you know, it's a medical term also. When they ask for the materials, you have to write the gauze. Okay. A material, when like a material used in covering a wound, the answer is gauze. But if it's a sterile covering, it's a dressing, because in dressing there are so many things that to put in. Okay?
Number ma'am?
Ha?
Nawala
Number
ako.
6. Number 6.
Eh, number 5 po, ano pong ano doon?
Dressing.
Dressing.
Dressing po. Tama po yung akin. Dressing.
Now, number
Number 6 po.
6, result from tearing of tissue by excessive force resulting in wound with jagged irregular edge. Ano kaya yun?
Bleeding.
Bleeding po.
Ano na?
Bleeding.
No.
Tissue trauma.
Laceration.
Yeah, laceration. Result from tearing of tissue. Yeah, it's a tissue drama of it's a tissue drama of our skin. But the thing is that it is the result from, what do you call from that one? Result from the tearing of tissue, excessive force already of wound. It become irregular already, the edge. So it is laceration.
Laceration po.
Yeah, laceration. Now, first aid should provide full and complete treatment. True or false?
False.
Why?
First aid is just the prevention, not the treatment. Complete treatment should be in a hospital.
Yes. Yeah. The first thing, if you have having an emergency or any first aid situation, you have to provide the first aid always. And the full complete treatment, it should be in the hospital. Like for example, you have this bleeding. So if the patient is bleeding, you have to stop first the bleeding. You put tourniquet like that. And then after that, you bring the patient in the hospital. Okay? Like that. Now, number 8.
Ano po yun, ma'am? True?
False.
False. Okay.
Naintindihan ninyo?
Yes po. False yung
Naintindihan
answer.
nyo? You understand? Okay. Shock can lead to death even though the victim injuries may not fully fatal. What I mean is that if the patient is shocked, it may lead to death, and even the victim is not injured or not fatal, meaning serious, can lead to death. True or false?
False.
Ano? It's true. True or false? It's false. It's false.
False.
It's false. Yeah. Always remember that shock can lead to death. Shock because, you know, the blood circulation already is diminished. The circulation of blood in our system is depleted already. So every time the shock, there is already a decreased supply of oxygen in our brain, in our blood circulation already. Okay? So if you think about shock, it's really very dangerous. And it can lead to death. Now, number 8. The other one, true or false? Pressure can apply.
Sa number 8 ano po?
Oo. Number 8 na ba yun?
Number 9.
Number 9 tayo. Pressure can be applied for a femoral artery to stop bleeding of lower portion of the thigh.
True.
True, yes. You know, when the patient is bleeding severely or not severely, you put pressure. If you put pressure on the, like for example, when you remember when they are taking blood for your examination like that, when after they removed blood from you, they put you a cotton balls or they put you a gauze and they tell you to put pressure Why? Because pressure, if you put pressure, it may decrease, it may prevent from bleeding. So always remember that one. When you have an emergency, you always put pressure when you have a severe bleeding. So the answer is true. What is good rule of thumb when dealing with a person that has been electrocuted in contact with the live wire?
Turn off electricity.
Yeah. What you will do?
Huwag pakikialaman.
When digs,
Them. Don't touch.
Yes. When Diggs hold the electrical circuit and then suddenly he was electric, do not touch her. Do not touch her.
Oh.
Do not touch. But the first thing is that you have to take something which is dry to remove the patient from the electrical. So the first thing, do not touch by your bare hand because you will be the next one also. It's better to take a blanket for you, and then after that, that's it. And then what else? The first step to take when you are like 11 pala yun. Don't touch.
Mali ano answer sa number 10, ma'am?
Number 10.
Don't touch.
Number 10.
Exact.
Don't
Answer.
touch. Don't touch them. Don't touch. Yeah. Don't touch them. Don't touch the person who has been. Yeah. Kundi makuryente ka. And number 11. The first step in helping electric shock. Number 12. Now, control by breathing. Profuse breathing cannot stop by using pressure. Now, when the patient is bleeding too much, and then you cannot prevent by putting pressure. You put a lot of pressure, but it's bleeding. What you will do?
Turn off.
No. What you will do first, if the patient having a profuse bleeding already, you have to put tourniquet. Tourniquet, you get anything, like for example, yung belt or anything that you could wrap onto the person so that yung para putin on the person and put any pen, a pressure for that one so that it will stop the bleeding. Stick like that. And then number 13, emergency situation can happen at any time.
Bleeding.
It is an emergency situation that can happen at any time. It is
Cardiac
first
arrest?
aid.
First aid ba?
First aid.
First aid.
First aid, yeah. It is noticeable by pain, redness, swelling at the site of the puncture, marks from stinger of
First
a
aid na.
bite.
Anong number po yun, ma'am?
13.
13.
Number 13, first aid.
Okay po.
Yung 11, ma'am, anong answer doon? 11.
Yung 11 na po kaming ano doon.
Turn off the power.
Oh.
11, first step to take when
Turn
helping
off.
electric shock.
Ma'am, number 10 yata yun.
Hindi.
Don't touch
Don't touch ata number 10. Number 10.
Number 10, when the
Don't
patient
touch.
with don't touch. Number 11,
Turn off.
Turn off the power.
steps. First step, when you want to help the patient who is in the electric shock victim, of course
Turn
you have
off
to switch off the electrical circuit or anything. You have to switch off first before helping. And then
Nalagay ko turn off the source of electricity.
Oo, tama na yan. Basta may turn off, okay na yun. And then, number 14 now. 14,
Okay po.
noticeable. Okay, you speak also, number 14. Anong sagot? I will not, ano na lang.
Insect, sting, and bite.
Insect bite, sting. Okay, number 15. What is the answer? A condition that reduces blood oxygen to the organ and even lead to death. We just discussed this one.
Shock.
Okay. Now, number 16. It is an
Burn.
injury to the skin due to heat, radiation, electricity, friction, contact with chemicals.
Burn.
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 Okay. First aid for fractures and broken bone.
Ano ma'am, ano yan? Anong question niya?
First aid
17.
fractures and broken
17. You know, you have to look for the questionnaire. Isn't it that I forward you the questionnaire? And then you look for that one. And then you put some paper beside you. And then you write the right answer. Okay?
Okay, ma'am.
So that you will not ask it anymore. Number 17, first aid for fracture and broken bones. Yun ay spleen.
Cut off pag
Pag,
The legs to come.
yeah, you have to immobilize the legs or the affected part so that it cannot be, the fracture will not become severe. When there is an accident, like for example, vehicular accident, you should not touch immediately, especially when the patient, you have to be very careful for the head of the patient, or even usually if the neck also. So you have to immobilize for the patient, or even if the hands also, like for example, the affected area is the hand, you have to put splint. Like for example, this yung hard bond, ganon, or any straight na hard thing, you could put on the hand of the patient to immobilize it. Now we're on
18.
can make a person very sick and even to death due to exposure to hot temperature and lack of water supply in the body.
Stroke.
it's stroke.
Right. It is stroke. Number 19. Itchy rash from poison, IV, or soma.
Rashes.
Rashes, okay. Caused by trauma, accident, or bad fall can lead to brain damage.
Head
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 injury.
injury.
Okay, number 21. Injury
Snake bite.
caused by venom injection that may lead to death if not treated
Snake
immediately.
bite.
Snake bite.
Okay. Number 22. Victim is pulled from water due to lack of oxygen and can cause brain damage.
Drowning.
Drowning, okay. Number 23, illness caused by bacteria or other toxin food, typically with vomiting and diarrhea.
Food poisoning.
Poisoning.
Okay. Trauma that damage by direct blow of the eye.
Head injury.
Eye injury.
Okay. Very good. Position of the patient in shock.
Trendelenburg.
Bugs.
Yeah. Always do not forget this one because it's usually come even in BLS also.
Number
Now we will
25.
go to Trendelenburg position. And then now, choose the correct answer. What is the compression on heat from the ratio of 2 persons in CPR for an adult? Letter A, 20:2, B, 30:2, C, 40:2, D, 25:2.
B. 30 to 2.
B, yeah, it's always B. 30:2. 30 compression and 2 breathe. Now, you just perform 5 cycles of CPR of an adult. You assess the pulse. You check for the pulse that. And then you have found out that there is no pulse present. Absent yung pulse. What is your course of action? Ano ang gagawin mo? Anong gagawin mo?
Call
What you will
911.
do?
Oh.
Search A. A, ma'am, A. Search for A.
Letter
Letter D.
A. A. Search for A. D.
CPR.
Call 911. C. Immediately initiate CPR.
A.
D. None of the above. No. It's you have to immediately initiate CPR. You do first the
Letter
CPR
T.
and then you call 911 immediately for that one. Because the patient had no pulse already. That is the critical part of the patient in BLS. When the patient had no pulse already, you have to do CPR immediately. And then after that, 911. Now, in
Okay
which
po.
location?
Answer po niya is C.
Yeah, C.
Okay.
And then, in which location do most out of the hospital cardiac arrest occur? When it's happening? Usually happen in?
Home.
Okay, good. Which is the most common cause of cardiac arrest in children? Letter A, cardiac problem.
B.
Congenital
B.
acquired heart defect. The cardiac problem, meaning to say that the patient already have existing problem. Congenital or acquired heart defect, meaning to say at birth the patient already have this heart problem. Respiratory failure or shock. Letter D, infection or sepsis. Infection meaning to say we have infection already from all his system. It's already reaches from all parts of his system already in the body. The answer is letter C. The common cause of cardiac arrest